Hello, everybody. My name is Steve Pressman from Practice Perfect EMR, and I'm here to take you through our Practice Perfect EMR application today. We're going to start with a little bit of information just about what we do, and then we'll jump right into things. So basically what Practice Perfect is a full practice management system, typically designed for outpatient rehab facilities, PT, OT, speech, some mental health, some ABA, sort of the big ones that we're dealing with. I would say probably 80% of our clientele are within that realm, PT, OT, speech, mental health, ABA, probably half pediatric, half adult. When we talk about being a full practice management system, basically what that means is we're giving you the ability to do everything from having the patients register online or having you enter the patient information into the system, all the patient demographic information, all the patient contact information, all the patient's insurance information, coverage limitations, anything like that gets entered into the system, any kind of special notes, special contacts, all of the charges get entered into the system. So you're doing your own billing through the system. So all of the charges get entered into the system by you, by the clinicians. All the payments are entered into the system, whether they're from patients or insurance companies, whether they're automatically, electronically posted or manually posted. We do have a full slew of account receivable reporting, patient statements, track outstanding balances, who owes you what, that sort of thing. So very easy to work your claims within Practice Perfect. We have a number of operational reports built in as well, allowing you to see things like how much revenue are you generating, who's generating that revenue, what sort of revenue is being generated based on different programs you might be offering. We get into more advanced reporting like productivity, what are clinicians doing, cancellation rates, no-show rates, other operational metrics. We get into patient follow-off, tracking patients who've not been in to see you. We get into the marketing aspects of the practice. Tracking where the business is coming from, what's working, what's not working. Do you have a physician that is no longer a good referral source? How much money are you generating from your website? That sort of thing. So a whole slew of reports to help manage the practice. Scheduling, all built in, all part of the system. And then we get into the clinical documentation section. Clinical documentation is everything from doing your daily notes and your goal tracking, that sort of thing, right up to document storage, preparing evals, full customization, all of that sort of thing. So we're going to jump right into things, and I'm going to start by logging right into the system. So I'm logging up on the screen here. Everybody does have a username and a password that you define. Main reason for usernames and passwords is you can establish who has access to what. Literally every function, every report can be turned off based on who the user happens to be. So if you don't want certain users getting into certain reports, that sort of thing, that's all completely definable. Maybe you don't have seeing financial information, completely definable by you. Now, we typically jump into a scheduling screen. Most of our users, when they launch into the scheduling screen. That's kind of the home screen. Another video covers scheduling in more detail. But the reason, and there's different views you can have and different things people can see when they log in, but the reason we typically jump onto the scheduling screen is that most of our users tend to run their day from here. In a nutshell, the way the application operates is as follows. You pick the patient you want to deal with, their name appears up top. You're then using these little icons to make things happen. I can add a new charge to Natasha. I can take in a payment and print a receipt for Natasha. I can add a new note for Natasha. I can look at her documents, something called a contact log. Perhaps I want to discharge Natasha. Then Carol walks in, same thing. I can do whatever I wish to Carol. Joe walks in, name appears up top. I do what I want to Joe. These icons are universal. It doesn't matter where you go within the application. They don't typically change. For example, if I'm looking at a list of all of my patients, for example, and I want to add a new charge to Carol, I can do it right from here. If I'm looking at, for example, Mike's name and address information, and I want to take in a payment for Mike, I can do it right from here. So it doesn't matter where you are. The icons typically are the same, which makes it very easy to learn and also easy to get around. Usually all of your key functions are only one click away. You're not having to go through 15 clicks to get to the simplest of functions. The other thing you will notice is no matter what you are doing in the application, whether you are adding new patients or doing demographic information, looking at financial screens, this frame doesn't change. The current patient that you're dealing with will always appear up top here with some information about that patient, both down the side and along the top. down the side of the screen, you have the option of having a picture of the patient. That's up to you. Patient's birthday and age, and their age appears right to the number of months. So if you do have a pediatric patient, you will see, for example, 62 years, 1 month old. Who is their managing clinician? Division, we allow you to basically categorize your patients. So if you are running different kinds of programs within your facility, physical therapy program, an early intervention program, a Medicare program, that sort of thing, you can attach any sort of a category to a patient and then run your reports based on those categories. Number of future appointments. So I know that Carol has one more appointment with us on March the 9th, and the patient's referring physician appears down here as well. Along the top, any kind of key information, allergies, anything in yellow, which is important to note, will always be on the top of the screen no matter what you're doing. Patient's balance. So if a patient does have an out-of-pocket balance, a copay, a deductible, something like that, shared payment, that will show up. Any personal balance of the patient will show up top here. And again, that can be turned off if you don't want certain people seeing that. Coverage remaining, also shown up top here. So again, if a patient comes in to see you and they do have a limited amount of coverage, a cap of some kind, whether it's a dollar amount, number of days, number of visits, that is always displayed up top. There is a report we'll get into in a different video where you can actually take a look and show everybody who's kind of running out of coverage, called the funding report. And there's also room for any other kind of comments that you may want to make up top here. In this case, kid had a spelling bee, ask how it went. Sounds kind of cornball, but this stuff works. This is all good for customer service. What we're going to do is get into some of these key functions down the side now. See, these are sort of the key lists that are the backbone of the system, and then we'll get into some of these other functions along the top as well. So first of all, now let's take a little look at what a client record looks like here. Clients, little plus would allow us to add a new patient into the system, fully geared based on multiple locations. So if you do have multiple locations, you can certainly filter your patients based on their home location, or all locations, whatever you prefer. Very easy to find a patient. I want to find my record, for example. First couple letters, we can bring a patient up. So just to kind of take you through what a typical client record looks like. And the client records can vary based on what sort of patient they are. For example, a private pay patient, we don't need that much information. We get into, in Ontario, for example, an MVA patient, there's a lot of information that needs to be entered about maybe perhaps multiple insurance companies, that sort of thing. So for every patient, we have, basic contact information, name, address, phone number, information, vaccine status, something newer that we've added into the application, emergency contact information, demographic information. Not all this needs to be entered. For example, maybe you don't need the marital status, maybe you don't need the social insurance number, health number, more for Ontario. So again, you only need to put in what is relevant. For example, maybe employer is relevant when we're dealing with a workers' comp claim, that sort of thing. Guardian information for each patient. If the patient's a minor, we need to know who the parent is. That sort of information gets entered as well, if you need to. Now, incidents, this is where things get a bit more complex. An incident, think of an incident as an episode of care. I come into the clinic maybe in January for a massage, have a course of massage, and then maybe I come back in the summer for something else altogether, a course of physio, different injury. Maybe I come in for a workers' comp claim in January, and I come back for an auto claim in June, something like that. So an incident is an episode of care, and each one of these incidents has its own kind of mini record within the system, its own services, its own potentially insurance companies, its own clinical information. So that's what an incident is. Maybe a patient is receiving both chiro and physio at the same time, and you want them to be maintained completely differently. So again, for each patient, you're going to have at least one incident. Within each incident, you're going to have a provider, typically, who's in charge of this particular patient for this particular episode of care. A lot of this information here is to help automate billing. It's not something you're going to necessarily use. Now, again, for each patient, each incident, we track both a physician that may have said to the patient, you need to get treatment, as well as a referral source. So for example, in the case here, David may be Joe's physician, and David may have said, look, I need you to go get physio. But he didn't tell him where to get physio, and the patient, Joe, found your clinic from your website, word of mouth, flyer, radio ad, that sort of thing. So we are tracking both the physician that's tied to a patient, but also how did the clinic, or how did the patient hear about the clinic? And again, we're reporting on that division. This is a category you can define: MVA, workers' comp, auto, TELUS, work injury, whatever you want to call it, and we can run reports based on those categories. Again, multiple offices. Is the patient perhaps being seen at an elder care facility at home? We then get into, and again, for private pay patients, there's not much more that we need. But again, when we get into insurance billing, depending upon the nature of the billing, we get into something called statistics. For example, MSP in British Columbia requires ICD-9 coding. Or ICD-10 coding. When we get into automobile accidents in Ontario, MVA, again, we need ICD-10 codes, and these are all built into the system as well. Treatment planning, not necessarily to put this information, it's more about breaking down the details of treatment. We get into billing rules, and again, you may have multiple insurance companies in here. In this case, we have the extended before we have the auto, which is the case in Ontario. Each insurance company may have its own coverage limitations. Each insurance company is going to have its own, if, for example, Great West has an ID number, but Allstate's going to have potentially an ID number, but also a claim number, also an adjuster. So it depends on the situation as to how much information needs to get put in for each patient. Again, very simple as the private pay. I would say automobile accidents in Ontario, MVA, probably the most complex. We can track tasks that need doing for each patient. Authorized providers, if you do want to lock certain patients out from being seen by certain providers, this sort of thing allows you to do that as well. So again, the client record varies rather dramatically based on who the payer is of the services. Private patients tend to be the easiest and the quickest to enter into the system. So the next thing we're going to talk about is something called payers. And payers is where all of your insurance companies are loaded into Practice Perfect. And a payer can be anybody from an insurance company, extended healthcare, auto. It could be a lawyer. If you have to send a lawyer an invoice, it can be an employer, an attorney. It can be basically anybody that could potentially be getting a bill. Now, in Canada, we have a number of different electronic integrations, just going kind of across the country here. In British Columbia, we do integrate with Teleplan. So you can submit charges directly to Teleplan, MSP, ICBC, WorkSafe. In British Columbia, charges are entered into our system and they get sent to Teleplan electronically. You can also deal with the remittances coming back from Teleplan as well directly. In Ontario, we have a number of integrations. In Ontario, we do a direct integration with HCI, we do a direct integration with WSIB, and we do a direct integration with OHIP. So what does this mean? Again, charges are entered into our system, and those charges are then electronically sent on whatever the appropriate form is to OHIP, to WSIB, to HCI. In the case of HCI, it's the OCF 21. Furthermore, in Ontario, specifically, you can prepare a patient's OCF 23 and 24, not just the 21, directly from here as well, and it gets sent electronically to the insurance companies, to the HCI and the insurance companies as well. And just to give you an example, it can go electronically, or you can even have the form printed sort of, on paper here and have the patient sign it. So all of these are integrated. The last integration that we do that's a national integration is we are tied to TELUS Health. So you can also submit claims directly to TELUS Health directly from here as well. The charges are entered to our system. They are electronically sent to TELUS Health, and then they are adjudicated right away. So right away, you're going to get a message back from TELUS that says, we are paying for this service, we aren't paying for this service. You can also do what's called a pre-authorization request, where I can say, if we were to do this today, what would we be paid? Now, again, Allstate is not an extended health company. So you can do a predetermination as well to the TELUS Health companies. These are very specific to province, except for TELUS. which is national. But again, if you have any questions about these integrations, MSP, HCI, WSIB, OHIP, or TELUS, please let us know. They're all very unique. Physicians, we do maintain a list of all of your referring doctors, family doctors that you are dealing with. And this all works the same way. Click on the doctor, name, all their information appears up top as well. So we'll go into this doctor here as an example. Again, name appears up top. Name, address, contact information, NPI number we do need for billing. Like with the patients up top here, there is room for you to make notes about the relationship with the physician. Any kind of special handling, special needs can be made note of up here. And by the way, on all the contacts, on clients, on payers, on physicians, we have full mailing label ability as well. If you want to do mailing labels or export lists to Excel, that sort of thing, that is all with a number of different formats. That's all readily available for you to do, and it's standardized. It's the same icon on all the contacts. Other contacts, for lack of a better description, other contacts is a clinic Rolodex, a clinic phone book, and this is where you can put anybody else you want that's relevant to the practice. This could be suppliers of your clinical product. This could be other healthcare professionals. This could be attorneys. This could be your plumber, for all we know. It's basically just a place for you to put any other contacts relevant to the practice. And again, it all works the same icons, notes up top, that sort of thing as well. Now, before we get into reminders, I'm going to go back a step and we're going to talk about something called a contact log. This little icon right here, that little telephone icon. Within each patient, you have the ability to maintain a list of communications with or about that patient. So for example, if you had a conversation with an adjuster about a collection issue, if you had a conversation with a doctor and maybe the doctor wanted a report in a week, or maybe the adjuster said, I'll have a check to you in a week, that sort of thing. Those kind of conversations can be loaded or recorded in a system and categorized, and you can attach a follow-up date. So in this case, we spoke to the physician. He wants to report next Tuesday. The report is due 1/25/2022. And we want to create a reminder. So what reminders are? These things down here. Reminders are things that you do want to pop up at a given day and at a given time. So for example, if I want today at, I'll make it 10:12, 10:13, 10:15 a.m., sorry, I have to call Dr. Jones about Steve P. He's overdoing his report. What that means is at 10:15 today, and this can be fed from the contact log, whatever I'm doing, doesn't matter where I am in the application, a bell is going to ring and a box is going to pop up that says, hey, you have to call Dr. Jones about Steve P. Beauty of these is you can send these to other people as well. So if you wish to, to remind one or more of your staff about something, you can put a reminder to them. It'll pop up on their screen at the appropriate time, or they can remind you, that sort of thing. So you'll see what those look like in a couple moments. Moving along the top, actually, here's an example of a reminder. This is a reminder that was set to come up just before we went into reminders. Spoke to a doctor, wants to report next Tuesday. So we're going to say, we're going to kick this particular reminder back by an hour. Or 2 hours, whatever we want, and again it'll pop back up, and it does get retained in this reminder list until you say it's completed, and even after it's completed, it goes into something called a completed log, so we can see which reminders have actually been completed. Last thing on here, deleted items. You can recover anything you've deleted. So if you've deleted a patient, if you've deleted anything, most things can be easily recovered as well. Now let's talk a little bit about these functions that go across the top of the screen. And we're going to start with file, very simply. Signing in, signing out, exiting out, that sort of thing. Pretty straightforward. Operations, just a rehash of these little guys down the side here, just another way of calling up the same lists that you have down the side. Now, actions, I always refer to actions as the oddball functions, the things you may use all the time, you may not use that often, depending upon your situation. For example, reversing payments. Reversing payments is how we record an NSF check from a patient. The patient has bounced a check on you. We need to bring it back out of the system, that sort of thing. We do have full inventory control built in. If you are selling ice packs, TheraBands, that sort of thing, and want to track stock levels, cost prices, minimum quantities, reorder, we'd have that built in as well. This ties into the online client portal for gathering appointments, the application of interest. We get into in Ontario, an HCI audit trail. We get into OHIP submissions and rejections. So again, it depends on your jurisdiction. We get into the MSP remittance. So a payment is made from MSP, a payment is made from OHIP in Ontario, the processing of those payments, reproducing of invoices. Now we do have a couple different options in the system for the notification of appointments. We have email appointment notification built in, no charge for that particular system. But we also have a couple different options open to you when it comes to text and phone call services for upcoming appointments to patients. We do have a straight integration with a company called Reminder Call. And what that is they do text messaging and they do appointment reminder calls, whichever you prefer for each patient. And there is a fee for that per call, per text message. Give us a call and we'll fill you in on that. The other option is we have something new called the Wired Client. The Wired Client is an entirely new automated texting campaign system in which reminder text gets sent out, but also things like happy birthday. We haven't seen you for 2 weeks. We know that you've canceled. Excuse me, you haven't rebooked. Hey, it was your first visit. How are you feeling? Hey, can you please fill out the survey? That sort of thing. It's a completely automated, set it and forget it texting campaign system becoming very popular. The beauty of it is it's two-way texting, which means the patients can actually reply to you and you can have a conversation with them directly through the application. So certainly give us a call about the Wired Client as well. Reports we're going to talk about a little bit later on. Documents. Documents is a word integration function that we have built in. So there's a lot of forms that are required kind of in the Canadian marketplace that are word forms that aren't electronically integrated by the payer. For example, I'm on Joe Auto here, and let's say for Joe, I wish to prepare his WSIB. This is an Ontario form. FAF form, that sort of thing. So what we do is we have this word integration built in which what happens is Microsoft Word will open and all of the information from the patient will fill in automatically on that particular form. It fills out that form for you. So here's an example. This FAF form for WSIB. Notice how it's filled in. All of these, anything we know about the patient basically has been filled in. We don't know some of this information, but we do know all of this information. So we do have this word integration built in as well, and all of the Canadian jurisdiction forms, are built in here. Continuing along, settings, housekeeping. This has to do with the setup of the system. We take you through all of these during the onboarding process. All these options here. And this is everything from setting up your users and what they can do to setting up all of your clinicians. So each one of your therapists are set up in the system, their names, their licensing information, their qualifications, their signatures can be brought in for documentation, electronic signatures on documentation, their virtual link for any telehealth that you're doing. And compensation, you can set up for each one of your therapists a compensation rate. I can say, for example, for every initial visit we're doing, we're giving Winnie 60%. For every EAP counseling Winnie is doing, she is getting $36. So you can set up compensation for your providers based either on what you're billing or what you're collecting. And there is a report called the compensation report that will show you what you have to pay your provider when payday is due. So that can all be set up as well. Even setting up your locations. We know nothing about you. We need to know your logo, your HST information, if you're collecting HST or GST, whatever the case happens to be, or provincial sales tax. So all of this information gets set up, your fee code schedule, what you're charging, the descriptions, your products, and we do take you through all of this during the onboarding process. So now let's take a little look at the Practice Perfect scheduler. First of all, there are a couple different ways to view the scheduler. Number one is I can see a given day. I can see Thursday with everybody working on that particular day. If someone is not working on a certain day, it will not take up a column. Columns are only there for people who happen to be working on that day. We could see the whole week if I wanted, Monday, Tuesday, Wednesday, Thursday, Friday, weekend, whatever, with everybody working. So if you want to see a full schedule for everybody, we can see that as well. Very popular view is this particular view right here. I'm Herb, the PT, and I just want to see my week. I don't care what anybody else has going on. Very quick and very easy to jump back and forth between the weeks. Things like the start times, the stop times, the intervals that you're using can all be defined. Red line indicates the current time of day that can be turned off or on. Appointments can be booked not just for patients, but for anything, a case conference, meetings, lunch, vacations, all that sort of stuff can be booked. Full drag and drop available, easy to pick up appointments and kind of move them around as well. Now, all kinds of pretty colors on here. What do the colors mean? The majority of our clinics tie color coding to the nature of the patient. I want all of my, perhaps my infants to be red, my early intervention kids to be green, my older Medicare patients to be purple. So completely up to you to define what the color coding means, what's most representative to you. Now there's all kinds of symbols on here, all kinds of indicators. We're going to take you through them. And again, all these are covered during training. But for example, we have some underlined patients. Randall's underlined, John is underlined. This is automatic. An underlined patient basically is a brand new patient. If you see a patient that's underlined, it means they have never been here before. Trigger to you, trigger to admin to do whatever needs to be done with a brand new patient. My favorite is the italicized patient. Randall, Pamela, Patricia, all in italic print. If you see a patient in italic print, what that tells you is they have nothing else booked beyond today, automatic as well. So let's say I'm a clinician and I'm treating Patricia. I'm not going to let Patricia walk out the door without booking something else because I noticed that she's in italic print. All kinds of symbols on here. We'll take you through them. The little hand icon, that means the charge has been entered for the patient. We deal with charge entries of Christiane, Louise, Robert. We deal with that in the documentation video. A little blue folder, you'll notice on Christiane, on Sylvia, on Roger. That means we have done and completed the daily note for today. So I can see for Sylvia, we have completed her documentation for today. Little money bag, you'll notice on Betty, on David. The money bag indicates that the patient will owe us money for this visit. Copay, balance, deductible, whatever it happens to be, balances are always shown up top here. But the money, again, it's a trigger. It means we should be dealing with money for this patient. Little phone icon, email icon means the patient received one of our automated appointment reminders. Little post-it note icon. I'm going to hover over one of these for a moment here. Jack, remember to get his paperwork. Robert said he would bring in money today. Elizabeth is going to be 10 minutes late. So basically, you can add a reminder to any individual appointment. These are not really kind of overarching reminders. These are typically more relevant for this one appointment. All we have to do is hover over the little icon to see what the reminder says. If there is no reminder, there is no icon. Finally, icon on the rightmost side, probably the most important one on the scheduler. This is where we indicate exactly what happened to the patient today. Every appointment starts off as pending, little hourglass. Our job is to go through the day and indicate exactly what did transpire. Did the patient complete their appointment? That's the one we want. That's the golden one. Did the patient cancel their appointment? Did they not attend? Or did they cancel and rebook? We do differentiate between a cancel with and without a rebook. So again, did the patient complete, cancel, no-show, or rebook? As an example, David phones up, I'm not feeling well, I'm not going to come in today. We drop down to cancel. We will then automatically be prompted for a reason as to why the patient canceled. You can either free type your own reason in, or you can set up your own drop-down reasons and just click them in as well. Now, very important thing to note is that we do keep all of those on file. At any point in time, if you need to get a list of all of the appointments that are booked for a patient, all the times they canceled, with the reasons why, all their no-shows, you can do that. You can get that anytime you want. We also have a nice little quick statistics screen right up here for each patient that shows you things like number of future appointments, number of attended, cancels, no-shows to date, some of their balance information, and as well, their next appointment is always displayed. Where is it? Future down here as well. This patient doesn't seem to have an appointment with us, that sort of thing. Now, how do we book new appointments? Well, let's go back to today, little circle here. Let's say, for example, that Suzanne wants to book into next week. Well, we can grab Suzanne, and we can just jump into next week. 2 ways to book appointments. We can either go one by one. Let's say a patient just wants sort of one visit, basically one click, one button, just to drop an appointment onto the schedule. We'll do another one over here. We can double click on a spot and just sort of type in a patient's name and book their appointment right from here. Very quick to do. But we also do have recurring appointments. I want Suzanne to come in every, Monday, Wednesday, and Friday up until the end of March, that sort of thing. Any conflicts, the system will let you know. And as you can see, that appointment has now been booked. The nice thing is you can move one of them in the middle. You're not wrecking the whole chain. That's our waiting list that came up there, which we'll talk about in a moment. We can delete one, for example, or maybe we only want to delete a few of them up until a certain date. So you have complete flexibility with those recurring appointments. And again, while you're booking a recurring appointment, if there is a conflict, the system will let you know. A bit about our waiting list function here. Basically, on the waiting list, we can take any patient that we can't see. You can't squeeze Carol in. She's too busy, you're too busy. So we can take any patient, Carol, slip and fall, want 60 minutes at our main location, maybe with a particular clinician, maybe with anybody. In Carol's case, she's looking for a Monday morning or a Friday afternoon. Well, the way this works is Carol goes on our waiting list. Now, the way the waiting list works is if you happen to be on your schedule, and let's say that somebody deletes, cancels, moves an appointment around, automatically, let's see if we have a bit of an example here for that. I'll just make this a longer appointment. So let's say Suzanne was to cancel her appointment, or we delete her appointment. Let's cancel her appointment here. Just give her a reason. It's going to come up and say, hey, I got Scott, who's looking for that 9 o'clock slot on Monday mornings. What do you want to do? So basically, it's an automated waiting list. We let you know the moment that the spot does open up for somebody, that sort of thing. And again, as I mentioned before, there are a number of scheduling reports to print out the scheduler for the day, for the week. And any questions about the scheduler, please let us know. Thank you. So now let's take a look at some of the reporting capabilities of Practice Perfect. Under reports here, reports are broken down into several different categories. We're going to start with the financial reports, and these tend to have to do with money owed to you. Accounts receivable, unpaid services, who owes me, how much do they owe me, current 30, 60, 90, 120 days, is something owed by a payer, is something owed by a client. Perhaps we just want to see, claims that are over, 60 days overdue, that sort of thing. Lots of different options on all of the reporting. Should specify that in the case of all reports can be set for any date range you want. You want to go back a year, a week, a month, no problem. And for example, in this particular case, we can maybe just see receivables for our clients, that sort of thing. So there's always options with these things. Every report, by the way, is also geared to be either by location or for all locations. So if you are running multiple locations, you can certainly have the report reflecting totals for all locations, or you can run individual locations, or even by zone if you have kind of an east region or a west region, that sort of thing as well. A couple other reports up here in note and finances. Unbilled services, charges that have not yet gone out the door to your insurance companies, a number of different ways of working receivables, payment journal, deposit report, typically run at the end of the day to balance your deposits to make sure what you've entered into Practice Perfect matches what went into the bank. Now, the operations reports tend to be of more interest. I'm going to run through a couple of these with you. We'll start with a compensation report. Compensation reporting, if you are paying your staff based on what they do, if you're paying them a certain dollar amount per unit, certain percentage per unit, certain dollar amount per hour worked, whatever it happens to be, either based on what's collected or what's been paid, the compensation report will give you back that information for whatever period of time that you specify. Another key report under operations is the daily reconciliation report. This report is a recap of the day's activities, charges, payments, that sort of thing, but it also shows if you've potentially forgotten to bill somebody. I have 30 patients on my schedule today. I've only entered charges for 29 of those patients. Who's that patient that we forgot to bill? Revenue that's accidentally not been billed. Funding report, another key report, take you through it. I want to see all of my patients that maybe have less than $500 of coverage left, or maybe they're down to their last 3 visits. or perhaps their coverage is expiring on a certain day. So this report shows you, and maybe I just want to see it for Medicare or a particular insurance company. So this report shows you who is potentially coming up on the end of their approved treatment. Very, very popular report. Another key report is the operations summary. Operations summary, think of this as a clinic report card. Kind of an all-in-one. I want to see how my practice is doing. I don't care if it's last week, last Tuesday, whatever. I can see anything I want, any day range that I wish. All reports, by the way, can be previewed on the screen. All reports can be exported to Excel. All reports can be exported to a PDF, and all reports can be faxed directly from the system as well. So I'll take you through this one, operation summary. Again, think of this as a clinic report card. Went back a number of years, broken down into several different sections. We'll start with revenue, all the different items you're charging for, how many you did during that time. We generated $28,000 in revenue during that time, 175 patient visits, 72 unique clients were seen. We then have a breakdown for each one of our clinicians, number of new patients they were assigned, number of patients they discharged, number of visits, revenue they generated, average revenue per visit, cancellation no-show rate by therapist as well. Get rid of one of our reminders here. Payment summary, so how much money actually came in during the reporting period. $16,000 actually came into the clinic. Activity summary, number of new patients broken down by category. So again, you can categorize your patients and or your referral sources. And again, we can get into much more detail here. Which physician actually referred which patients, how much revenue was generated by our website. This is just more of a synopsis. Very key, number of discharged patients. We have 4 discharged during the reporting period, 2 completed treatment, 2 were self-discharged. Now, when a patient leaves your care, we want to know why they left your care. Did they complete treatment? Did they wander off on their own? Did their funding expire? Did their doctor pull the plug? We like to track this because we're big on tracking compliance. How long are patients sticking around? And if they're not sticking around, why aren't they sticking around? Number of active patients broken down by category. We have 13 more patients in our clinic at the end of the reporting period that we did at the beginning. We have $8,000, close to $8,000 in unbilled services, charges that have not yet been billed to the insurance company. And we have a snapshot of our receivables also on the same report, kind of a nice little all-in-one. A couple other reports of note in operations. Revenue reporting, again, tons of options on this report as well. Revenue reporting is basically a kind of a recap of charges that have been entered. I want to see all the charges entered during a certain time. Maybe I just want to see a certain payer, a certain provider. I want to see maybe a summary, not detail, that sort of thing. But basically what this report is a recap of all the charges that have been entered during a specific time frame for you to kind of review and make any corrections that may be necessary. A couple other reports of interest here. Treatment statistics. Very interesting. This is a cost and length of treatment report. This is a report that will show you, I'll just jump to the end here, that will show you, for example, how many visits people are sticking around for on average. 50% of our clients had no visits. We didn't get a breakdown by injury type. I can see that our average lumbar disc displacement patient is here for 49 or was here for 16 visits at an average of $3,000 per patient. So how long is it taking people to get better? That sort of thing. Very, very popular report under operations is something called the provider performance summary, especially valuable in larger organizations. What this particular report does is compares your performance between your clinicians, each one of your clinicians, things like total scheduled hours, total hours that they're unscheduled, meaning they're idle, what percentage of their time is spent with patients, so productivity, changes in client load, cancellation no-show percentages, how much revenue have they generated during the reporting time, how many units per visit, why is one particular clinician billing more per visit than another, how much revenue per visit, how much revenue per hour are they generating for your clinic. And again, all this information is just a byproduct of the information you're entering into the schedule and into billing. On to our next category, marketing reports. We can do full exports of our clients, all sorts of information. And again, we can look at referrals. We can look at numbers, dollars, that sort of thing. But we can, for example, see exactly where our referrals are coming from. Referral sources down the side, months along the top, how many referrals were there from each referral source. Again, we can do dollars. We can do detailed listings as well of the actual referred patients. All of that is built in. Missing fields report, we can track if information has not been entered based on the office person. Scheduling, number of different ways of printing out your schedule for the day, for the week, for therapists, that sort of thing. One of the most important reports in the system I really do promote is the patient fall-off report, key report. Can you please show me all of my patients I haven't seen for the last 2 weeks? Maybe I want to do it by one particular clinician, that sort of thing. And what this report is going to give you is a list of all those patients who've basically vanished. I have 8 patients here. Here's who they are, why they were coming in, some of their history as well. So these are 8 patients that we have never discharged. We've never said don't come back. We've never said you're done, but yet we haven't seen them since the end of January. And the goal here is to get these patients back in the door, to get them engaged. If they're not going to come back in the door, then let's discharge them appropriately so our data on treatment length is accurate, that sort of thing. A couple other reports of note, task and clinical. This is where we get into our contact log reporting. This is where we can say, for example, can you please show me all of my patients who have made a collection promise who were overdue on their actual promise with the stories they gave. I want to maybe see all the adjusters who broke a promise, all the doctors I owe reports to, that sort of thing. Task reporting also shows us if there's signatures that are missing, evaluations coming up, that sort of thing. So it's all about tasks that either need to get done or things that have been promised to you. We do have a couple inventory reports as well. And then a new category for us, security and audit. This is where we can actually take a look at when users logged in and logged off and look at what they did when they logged in and when they logged off. So we can see what a particular provider may be up to during their journey through the program. And that concludes our section on reports. If there are any questions, please don't hesitate to ask. Now let's take a little look at the financial, bit about the financial aspects of Practice Perfect, and then we'll get into some of the clinical documentation. So this is an entire sort of subject topic unto itself, the financial, but just to give you a bit of a look as to what a financial record looks like, the kind of information that we're storing about each particular client and their treatments. We'll take Alan as an example here. There's a couple different icons that we can use to get into the financial record. Services, claims, invoices, payments that were made. This is one typically people use the most, this little icon right here called the activities by service. This is going to take me basically to a ledger for this particular patient. So just to show you the kind of information we do store for each individual patient, every date they were here, who the charge went to, what was done, their CPT code, the description of the service, the therapist that did the work, how much was charged. That means the charge has been entered into the system. How much is billed? Billed means it's gone out the door to the clearinghouse, the insurance company, so these charges have not yet gone anywhere. How much is paid for each one of these services, and therefore how much is actually due for each one of these services. And we can expand any service, and I can see the split between client and payer, for example, if there's a copay. We can get into much more detail for each service as well. I'll expand, for example, excuse me, the service on the 31st, this 97140, which has been charged, billed, and paid. We do maintain for each individual CPT code a very detailed ledger of exactly what has happened to that charge. For example, I can see when the charge went out the door on January the 13th. It went on something called the HCFA e-bill to the clearinghouse. I can see that we got paid for it a couple weeks later with a check number. There was a $64 write-down. In this particular case, I can see the check number as well. In this particular case, I can see there was a $7 shortfall. That was the patient's responsibility. I can see the fact that we transferred that $7 from Blue Cross to Alan. I can see that Alan received a bill for that invoice, for that service. And I can see that 8 years later, Alan gave us a check to pay for that service. So whether it's a copay, a deductible, a secondary, a tertiary insurance company. Maybe it's gone from 2 insurance companies back to the patient. The entire history of that charge is recorded on our financial ledgers. And again, happy to go into more detail with this if you require any more information. So let's get to the actual documentation. Now, when we look at documentation, there's 2 key areas we look at. We look at the ability to do and review daily notes. That's adding a new daily note, reviewing daily notes. And then we look at documents. And documents are basically anything that's not a daily note, evals, x-rays, letters, that sort of thing. So the clinical record is basically made up of 2 different sections, daily notes and what we call documents. Now, we're going to start with a daily note for Carol. Carol comes in today and we want to do a new daily note for Carol. We're going to click on this little icon right here, which takes us to a new SOAP note for Carol for today. I also want to stress a lot of this is customizable. If you're not using SOAP notes, if you're using something else, there's a good chance we can accommodate. So first of all, on every note, we have room for 2 providers. So let's say you do have 2 clinicians working on a note. Each can sign off on the note independently if you wish. Date, time in, time out, typically comes right from our scheduling system. Duration we're going to talk about in a moment. The only reason these did not show up is I did not check the patient in and out. Then we have the actual note, subjective, objective, assessment, and plan. We can make the sections bigger on their own tab if you like as well. Now, we just did a brand new note, but yet there's a note in here. How come? Well, by default, what we do is we bring forward the note from the previous day. So what I'm looking at here is the note from the last time the patient was here, and it's been brought forward automatically to today. Why? Because things typically don't change very much from day to day, and I can change whatever may have changed, that sort of thing. Maybe I want to bring forward a note from a different date. I can do that as well. And again, you can wipe these things out, you can type over them, you can do whatever you wish. Now, the other shortcut that we have is over here on the right-hand side. We give you the ability for you to establish your own list of commonly used expressions and phrases. So I have a category of my commonly used phrases that I've set up called objective findings. Within objective findings, I have about 40 or 50 phrases that I like to use. These are my phrases. I've set them up. If I click on them, you can see them displayed down here. Click on this one, displayed down here, that sort of thing. So let's say I want to use my thoracic spine findings phrase in here, in my objective section. All I have to do is double click on the name of the phrase, watch the left-hand side, and the entire phrase automatically populates. In this case, the patient's name populates. I'll fill in the word, mild, that sort of thing. I'll grab one more and I'll put it in the back muscles, that sort of thing. Let me grab another one, something called home exercise review. I want to place that right there, put my cursor right there, double click, and that phrase gets entered in here as well. Very easy to add your own phrases. You type the phrase once, you highlight it, add it, give it a name, and it brings it into your list of phrases. There is no limit to the number of phrases. There is no limit to the length of phrases. There's no limit to the number of categories. Phrases can be assigned. They can be assigned either to yourself or to somebody else. Like you can have phrases that are your own, or you can have global phrases. That's completely up to you. Now, a couple other things we can do with a daily note in no particular order. Number one, probably first and foremost, is goal tracking. So when a patient is first assessed, you can enter a series of goals for the patient. We have about 1,000 goals built in. PTOT speech, you can get rid of these, you can add to these, you can edit these, you can free type your own goals, no problem, long-term, short-term. But our goal on a daily note is to indicate exactly what happened today. So I worked on this goal today, I worked on this goal today, I worked on this goal today. We can alter the percentage completion if we've supplied one. We can also talk about the actual intervention we did today for this goal, and these are brought forward as well. So we have the goal tracking. Goals met if they happen to be met. If you're doing PT, maybe sometimes OT, we also do have a body map built in. A body map, again, brought forward from the previous day. Pain point number 1 was a 5, maybe today it's a 4. Pain point number 2 was a 3, maybe today it's a 2, with a comment, that sort of thing. So again, these are brought forward as well. There's also the ability for a patient to sign off on a note. If you want to hand your device over to a patient, have them drag a mouse over and sign the note, that ability is there as well. Once a note is done, you can deem that note as being completed and signed, certify this note is good and true, that sort of thing. We can do annotated notes if we need to as well. Now, right from here, if you want, this is up to, depends how you enter charges in the clinic. You can have, right from here, clinicians entering their own charges for the day. Some 97530, some 97124. We'll pick a different code than that. We'll do some traction perhaps, number of units, duration. And again, there are time checks that are built in, and a lot of this can be automated, so you're not having to put anything in if they're having the same thing all the time. But the therapist can enter their own charges, or your billing people can enter the charges later or earlier. We don't regulate when charges get entered. It all gets matched up at the end of the day or the end of before you're going to do your billing. But this way, the therapist can't put their charges in. And again, this can be automated. Modifiers, for the most part, are automatic. Medicare, for example, KX59s are automatic. And the ICD-10 codes are brought forward from the previous day. And this is basically now entered into the system. This note is in the system. If I go back to the scheduler, if you remember back to our scheduler demo, the little hand icon means the charges were entered. The little blue folder means that the notes are done for today. And if I take a look at their financial record, which we covered off earlier today, you can see here's the charges that were entered for today, the ones we just talked about. So it's all feeds the billing system immediately. Now, how do we go back and take a look at notes that may already be in the system? Well, that's what that little icon right there is for. And I'm going to click on that. And what this is going to show me is all of the notes that I have on file for Carol by date. Little target means we've entered goals for that date. So let's say, for example, I wanted to print or fax 2 months worth of notes for the patient. We can do that right from here and print them, fax them right from here. I can get back into any day, back to today. I can scroll through my notes, day to day to day. I can take a look at the goals, the body map for that particular day. I'll go back to today. What do these look like if you do need to print them, if you do need to send them out the door? I will give you a sample of that, little print button here. And again, you can turn things off and on. Maybe you don't want to show the body map. Maybe you don't want to show the goals, whatever the case happens to be. But just to give you a bit of an example, and there's different versions of this. This is one sample here. Typical daily note looks like this. We have your logo, your name. 1 second here, sorry about that. We have your logo, your name, up top here, treatment note, daily note, soap note, whatever you want to call it, the client's name, the provider's information, time in, time out, duration, if we had entered it. You know what? I am on the wrong date, which is why certain things are not showing up. I'm going to go back here, and we're going to go back to today. And we're going to do this again. So I'm going to print this, and we're going to try this again. That's better. So again, now we're on today. The system is only good as what you tell it to do. Time in, time out, 60-minute duration. That came from the services that we entered, our 60-minute duration right here, the modifiers. I can see the ICD-10 code, subjective, objective, the goals we worked on today with the interventions, the assessment, the plan, the services we performed, which you can turn off or on, the body chart, which you can turn off or on with the legend. At the very bottom, you will see the signature or signatures of the providers, their names, their qualifications, their NPI number, and as an option, you can show the date of signature for a patient, as for a note as well. So again, a lot of this can be turned off or on, but that's a very typical example of a printed note. Now, the other section we want to take a look at is this little 2 pieces of paper icon right here. This is like opening up the paper file for Carol. And in the paper file, you're going to find all kinds of things. You're going to find x-rays. You're going to find lab reports. There are letters you've written. You're going to find evals. So basically what this is a list of all the documents that you have on file for the patient. Their date, is it a JPEG, a Word document, Excel, a PDF, anything you wish. Who put it there? You can filter them and categorize them. How do we look at one of these? Here's a lab report, for example. How do we look at that? We highlight it, a little magnifying glass, and it is the actual lab report that maybe we've received in. or maybe it's the actual x-ray that we have received in, that sort of thing. There are basically 3 ways to get documents into this file, into this record for the patient. Think of this as the Dropbox for the patient. Number 1, we can go directly from a scanner. Patient walks in, they bring a referral slip with them, throw it into your scanner, click that little button, launch the scanner, give it a name, it will bring that image directly into their record. Import, very popular. I've received a JPEG, PDF, a Word document, all these different formats here, Excel, a video, an audio, and I want to bring those into the record. Maybe you've written a letter in Word. So this is how we bring those documents into here as well. And then we also do have a number of documents built in, evals that are built in. And I'm going to grab an eval here. So a typical eval here, we'll grab one down here. We have a number of these built in, PTOT and speech, but our evals are for the most part, are forms. I mean, they really are kind of glorified forms. But everything you're seeing here, every tick box, every heading, every drop down, so I have an example of a drop down here, every drop down that we have, all of this can be defined. There's some drop downs on here. So anything you're seeing here can be altered. Headings, if you want to create a brand new document, if you want pieces of this document, you can use the predefined phrases. So these are completely definable. And again, when you print these evals, when you want to send them out the door, or plans of care, or whatever you want to call them, again, it makes it look all pretty with headers and footers and signatures and all that kind of stuff as well. The other beauty of these customized documents is, A, you can customize them yourself, or you can have us do them for you for a fee. But B, you can set it up that if you don't fill something out, a field, it doesn't print. So you don't end up with a 30-page eval with a whole bunch of blanks. So there's a lot of flexibility here when it comes to both your daily notes and your evals. If you don't like what we've provided with you, it can be altered, or you can completely create your own. And I hope you enjoyed that review of our financial and clinical documentation systems.